Hi everyone, my name is Eliana Sejas and I will be doing a fall prevention strategy in the geriatric population. The reason I chose to do this is because there is an increasing number of fall-related injuries in 65 years and older in the geriatric population that leads to hospitalization and can also, and sadly, unfortunately, lead to death. Um, Falls are very detrimental, and if we can prevent them, um, the geriatric population would be able to continue on with their activities of daily living. Therefore, I believe it's extremely important to emphasize how to properly use safety devices, um, what things would put someone at risk, and so forth. In my presentation, I will focus on three main things. First, I'll go over the content. The second portion would consist of a demonstration, probably by a physical therapist or someone, on proper ways to stand up from a chair and sit down using a walker or a cane, and then I would expect the audience to do a return of demonstration. And the third section of this would include doing like a small survey of whether this presentation assisted them in um, reducing their fears of falls, if they found this um, useful, or if they can put it for use. Uh, so let's go forward. We are going to talk about the intrinsic and extrinsic factors, such as intrinsic, internal, things that could affect the person, such as their age, having a previous fall in 6 months or less or prior, having muscle weakness, gait imbalance problems, poor vision, postural hypotension, chronic conditions such as having arthritis or a stroke, being incontinent, having diabetes, Parkinson's, dementia, any fear of falling that can affect this. Extrinsic factors would be things in the environment, such as not having handrails on your stairs or having a poor stair design, the bathroom not having grab bars. I've been, I work as an aide, so I've heard of so many falls that could have been prevented if there was just more extra safety devices at hand. Um, the lighting being dim, having carpet rugs, tripping hazards, uneven surfaces, and psychoactive medications, and not properly using assistive device, which is what I wanted to mainly focus on. Um, let's see. So, in order to reduce the number of falls in women and men, it is important to talk about things that can help them, such as doing strength-related training programs. These have shown that they can reduce the number of falls. Education on environmental hazards, and things that lead to falls. So, if um, during my presentation, I will encourage them to look at the Moore's Fall scale and see if they fall in one of the categories to see if they're at risk for falls, whether they're low risk, high risk, or moderate risk. And this basically goes over how many falls have you had in the previous year? Are you diagnosed with something that can increase your risk for falling? Do you use any aids such as like a walker, crutches, a cane? What's your gait like? What is your mental status? Are you forgetful? Are you oriented? So I think that scale would really help them to see if they're at risk. And I want to use the PEAK model for readiness to learn. And this is basically a model that looks at the patient and evaluates them to see if they want to learn about how to prevent a fall. So it looks at their physical readiness, their emotional readiness, their experimental readiness, and knowledge readiness. I think this is key because a lot of patients can say, yeah, I don't want to fall, but it doesn't mean that they're going to be ready to learn what it takes to reduce their number of falls. For example, in my demonstration portion, I wanted to do proper ways of sitting and standing. And although these seem very simple things to do and common, you'd be surprised on the number of people that, stand up using their walker instead of the chair, and so that walker can just slide right over and they can fall. Or when they're sitting down, instead of bending back and reaching over for the chair, they just plop down, and that just damages more of their bones, and it can lead to fractures. So it's like those small things that need to be reinforced, that make a difference. And yeah, so those are things that we need to assess. Is this patient ready to learn? So looking at physical readiness, we're going to look at their health status and their environmental effects, such as are they distracted? Are there a lot of interruptions? Is this task complex for them? And that depends on the person. Do they see this as a complex task? Does this person have dementia? Does not? So it just depends. In regards to emotional readiness, are they very anxious while learning? Do they have a support system that can help them during this time of need? What are some risk taker behaviors that they have? Frame of mind and developmental stage experimental readiness. Do they want to learn? Their level of aspiration, any coping mechanisms, cultural backgrounds, orientation, and knowledge. Cognitive ability, readiness, disability, and learning style. What is their learning style? So are they more of a visionary, an auditory, or a kinesthetic learner? So I tried to implement that in my PowerPoint, where I'm going to be talking about the strategies, and I have a hands-on experiment, not experiment, but a hands-on return of demonstration with the sitting and standing with a physical therapist. So let's go into what are the proper ways of sitting and standing. So when we're doing this part of the section, we want the patient to scooch the edge of their chair, and it's going to be a small group. We're going to have probably a ratio of 1 instructor to 5 people. So we're going to have them scooch to the edge of the chair, feet are flat on the floor, the toes are underneath the knees, and we want them to push off using their legs, using a head movement looking up, nose leaned forward. And so that is using the chair to stand up and not using the walker to lift up. Bending at the knees and guiding the hips to go up. Another way that we would do is doing a sitting down demonstration. So when they're sitting down, they want to reach their arms back and make sure the knees are touching the chair with their arms on their chair, and then sitting down instead of just plopping down. Some things that we see common is that they use the walker to help them stand up instead of the chair, and they plop into the chair. So with this return of demonstration, after that we're going to give out a pamphlet of proper instructions and some safety devices such as crutches and canes and walkers. And then at the end of it, we're going to do a small survey about whether if this helped reduce the number of falls, do they feel more at risk for a fall, and yes. And yeah, thank you so much for listening to my presentation, and I look forward to learning more about my other classmates. Thank you. Presentation.